So if you have a look at this animation, you will see that the retroglossal area behind the tongue, the area right over here, is a little bit narrower than what it should be. And what happens is if there's a little bit of excess tissue in the uvula and tonsillar area, it'll vibrate as the patient breathes, especially at nighttime, causing snoring, and in severe cases can completely obliterate the airway to the point where they stop breathing for a short period of time. When they stop breathing for a short period of time, the brain has an oxygen sensor and it says, hey, you're not breathing, and it causes what they call an arousal. And it takes you from a very deep, restful stage 4 sleep into a lighter stage of sleep, like a 3 or a 2. And you're not necessarily even aware of it. You wake up in the morning and you feel like you haven't had a good night's rest, and you haven't really felt like you've slept the full 8 hours, even though in effect you've been lying there for 8 hours. And really what it is you've had so many potential arousals over that period of sleeping time that you haven't dropped down into that deep stage of restful sleep. So people complain because their partners are snoring or they're tired in the day. But for physicians, we're concerned because they're not getting enough oxygen to their brain. When you look at this animation over here, you'll see how as you advance the mandible or move the lower jaw forward into a more advanced position, how it allows the airway to open up. It takes the uvula away from that area where it tends to vibrate. And that can be accomplished numerous different ways. There's an appliance that we can give patients, and they wear it at nighttime. It's a mandibular posture device where it gently postures their mandible forward. It's quite unobtrusive, and 95% of people find that they can tolerate it really well. And they wake up in the morning where they feel like, wow, what a difference in terms of the amount of restful sleep that they perceive. So on some patients that don't want to wear that appliance indefinitely, or that are willing to go through a surgical procedure, there are procedures that we could do where we can permanently enlarge the airway. One of them, for example, on Stephanie, where her airway was so severe, is called an MMA, and it's where the maxilla and the mandible are physically advanced or moved forward in position and held there, and I'll show you the animation over here. So here we see an animation where the airway is really narrow, and here you can see the normal airway, and here you can see where prior to the procedure braces are put on. There you could see the incision that's made called the Lefort 1 osteotomy, a cut that's made on the upper jaw to move the upper jaw forward. There you could see what they call a bilateral sagittal split osteotomy, the lower jaw surgery. Plates are put on in order to hold the pieces in place. Bone tends to fill in within approximately 3 weeks. And you could see as the mandible is advanced how much airway we have, and the before and the after. People like it because it makes it look good. You can see the maxilla, or the upper jaw and the lower jaw are forward positioned, so they like the way it looks, but mostly they like the way it feels because there is enough air to allow them to have a restful, deep stage 4 REM sleep.